My name is Rachelle Crescenzi. I'm from the Vanderbilt University Institute of Imaging Sciences, and I do study imaging, so this talk will focus more on our imaging work, focusing on, again, a whole body theme, so whole body imaging of lipedema. I have no conflicts of interest to disclose. And overall, the clinical problem that our research seeks to address is the fact that lipedema is commonly misdiagnosed as obesity or lymphedema. And this is a real problem because common treatments such as diet and exercise, as we've just seen, or physical therapy are less effective in participants with lipedema in reducing their symptoms. And so we come to the situation that while symptoms onset at puberty or pregnancy, the average age at diagnosis currently is 44 years of age. That's right. So what is really clinically needed is for tools to allow for an earlier diagnosis of lipedema and for the ability to evaluate therapies that would benefit all stages of lipedema. And so our group is called the INFORM team, and our goal is to develop non-invasive imaging methods to study the onset and management of lymphatic impairment disorders. And so we come from a variety of departments at the Vanderbilt University Medical Center as well as the Imaging Institute. And over the last 3 years, we've worked to develop non-invasive magnetic resonance imaging methods to study the lymphatic system generally. So I'll take you through these. We've optimized methods to image the lymphatic nodes at higher resolution throughout the body. And, oh, sorry, why does this keep happening? Okay. And also, we developed methods to look at lymphatic vasculature non-invasively using MRI. And this is an example of MR lymphangiography in a patient with upper extremity unilateral lymphedema. And the bright signal intensities and the arrows are pointing to regions of edema in this patient with a known lymphatic impairment of lymphedema. And additionally, we've demonstrated methods to visualize lymphatic vasculature. So the image on the bottom with the yellow arrow is showing abilities to image the lymphatic thoracic duct anterior to the spinal cord with this technique. And we first optimized this technique in participants with known lymphatic impairment due to a unilateral lymphedema, and then applied these techniques into participants with lipedema. And here I'm showing MR lymphangiography of the lower extremities, where we demonstrate bilateral edema as well as dilated vasculature in the legs. Additionally, we pair this imaging method with abilities to study tissue composition using MRI in terms of fat content and sodium MRI. And so next, I will show you the initial results that we gathered and published a year ago. And so in a first cohort of participants with lipedema and compared to healthy females, I'm showing here our results of tissue sodium content in the legs on the graph on the left and fat fraction in the legs on the graph on the right. And so starting on the left, the gray boxes represent data from the healthy female control cohort. The white boxes represent data from the lipedema patients. And you can see in 3 regions of interest in the leg, in the skin, in the subcutaneous adipose tissue, and in the muscle, there's a higher level of sodium that's being stored in the skin itself. This is independent of circulating blood sodium levels. And so these values were statistically elevated in the skin and the subcutaneous adipose tissue in this initial cohort. And comparatively, the fat fraction was also statistically elevated in the calf of the legs of patients with lipedema in this first study. And so our next hypothesis was to understand, again, as a whole body comparison, compared to the upper extremities and the lower extremities, are these features of higher fat and sodium content local to the legs, or are they also found in the arms? A very simple hypothesis. So we enrolled a different cohort of participants with lipedema and female controls who were matched for age and BMI. And we took them through an MRI protocol incorporating whole body MRI as well as sodium MRI of the arms and the legs. And we also asked them to undergo a standard pain assessment using the visual analog scale, asked them about the level of daily pain they experienced in their legs from 0 to 100. And so first I'll show you a few case examples of our imaging metrics, and then I will go through the group level results. So here's an example of a whole body MRI from a healthy female on the left and a female with stage 1 lipedema on the right. And what I want to note is that these 2 females have a very similar BMI. And now these images show in the white part of the image is the fat tissue in the body, surrounding the muscles in the darker regions of the image. And if you start at the waist, you can compare a similar amount of fat tissue in these 2 examples, but as you scan down the legs, you can observe a greater amount of the white or the fat deposition in the legs of lipedema. We can see this visually. So now let's focus on the calf. On the image on the top is representing fat tissue in white, and the image on the bottom has a different contrast. It's representing the muscle tissue that's now bright or white. And from these images, we can measure the amount of the volume of fat tissue compared to the volume of the muscle or the water-weighted tissue. And we produce this metric that we're interested in called the fat-to-water ratio. It's a fat fraction metric from the calf. And you can see in the participant with lipedema, this is 3 times higher than the participant, than the healthy female without lipedema, and they are BMI matched. So this is really a local level of fat deposition. So here's another example of an early stage lipedema patient compared to a female within the same decade of life with a similar BMI, as well as calf circumference. And the image on the left is showing the tissue fat content in the leg. And so the white region shows a thickening of the subcutaneous adipose tissue that you can observe, and this fat fraction metric, or fat per water ratio, is slightly higher in this participant as well. And now the images on the right are showing corresponding sodium MRI images of the same structure in the calf, and these are colored images. So the warmer colors of yellows and reds correspond to a higher level of tissue sodium. The cooler colors of blue represent a lower level of tissue sodium. And we focus on 3 regions of interest: in the skin, in the subcutaneous adipose tissue, and in the muscle. And in all these regions of this case example, we see elevated tissue sodium throughout the leg. And so here are the group level results when we repeat this in the arms and in the legs. And again, this is a different cohort that we enrolled than our first study. So starting on the arms, we observe a trend for increased sodium in the skin of the arms, but as of yet, with our current enrollment, this is not statistically different, but I think it's interesting to note there's a trend, and it's local to the skin of the arm. The graph on the right is showing leg tissue sodium, and we have observed a significant elevation of sodium in the skin and in the muscle of this cohort. And high tissue sodium overall seems to be unique to the legs compared to the arms, so this confirms the regions of involvement that we know are involved in lipedema. So next, let's look at how the results of fat fraction compare in the legs compared to the arms. We know there may be some involvement of the arms in lipedema, but to what extent is it the same or different than how the legs are involved? And so here you can see our fat fraction metric derived from the MRI on the graph. And in the legs, we measured a statistically significantly higher amount of fat in the legs. And this is compared to the arms. There was a trend for this elevated fat content of the arms, but it was not yet statistically different. And so among all of these participants in our studies who have undergone MRI, as well as pain assessment, we wanted to evaluate the relationship between their experience of pain and the amount of fat content objectively measured in their legs. And what we've observed and measured is a significantly correlated trend between standard pain assessment and their fat fraction metric in the leg. And we think this is a start at objectively measuring pain, although this metric can be improved, we think. But we do think it's important to pay attention to this population and their representation of pain and how this may be impacted by the levels of tissue content that are different in terms of fat and sodium. And so in summary, we've developed a non-invasive MRI protocol that can be performed in less than 30 minutes. It uses commercially available equipment, and it's therefore clinically feasible. And so far, our results have shown that tissue sodium and fat content in the legs are higher in lipedema compared to females matched for age and BMI. And so our ongoing research is to use some of these MRI metrics to understand the response to physical therapy. And currently we're undergoing a trial using negative pressure physical therapy in collaboration with Dr. Paula Donahue, who's present with us today. And as well, we are partnering with the Lipedema Foundation Registry to continue to provide objective and deep phenotyping of lipedema patients. So thank you so much for your attention. I just want to acknowledge my colleagues at the Imaging Institute, as well as our clinical collaborators throughout the medical center, as well as our collaborators, Karen Herbst, and our funding resources as well, so the Lipedema Foundation, the FDRS, and the National Institute of Nursing Research. And we thank you all very much for participating in our research in the past. And I think that is it for today. Thank you.